You see a lot of adults who are having a hard time. Are there things that you know now about what we can do in kids and adolescents that can prevent some of the adult outcomes that you see? Is there something that you could tell us today about how to manage kids and adolescents to prevent the experience that some of your adults are having at this time?
From my experience, humble as it is, I can tell you that there's no adult that I've seen with severe symptoms that whose symptoms are totally dissociated from their relationship with the parents. And it is shocking to me that oftentimes that relationship continues right into their 30s or 40s and their 50s, and it's the inability to break that link that makes it extremely difficult to manage the symptoms. And oftentimes these are things that are done with the best intentions. And we've talked before about issues of codependency and so forth that tend to emerge around this critical time of development, pre-adolescence, adolescence, and beyond. And that once these patterns of behavior get established, they're very hard to break, and they become the major barrier to your succeeding in treating the subject.
So, not necessarily causal.
Not necessarily, but they're kind of like the wrench in the equation that prevents the natural biology of the illness that allows the tics to become a little bit better as they get old. The attention deficit, the hyperactivity symptoms do not be perhaps as prevalent in their 30s and 40s as they were as a teenager. So it changes the natural course of the symptoms, not necessarily the biology. And it's a change in the natural course that is not as amenable to the drugs that we're talking about here as they are when they're younger.
Yeah, you know, that's. Do you guys have strategies for how to prevent the development of that in kids and adolescents?
I was just thinking about, as he was talking, and you mentioned earlier about I see some adults, and if they're in their 30s or 40s now, or even 20s, they were treated according to the period of about 15 years ago. And sometimes I think to myself, gee, it's unfortunate that this person was hit so hard with neuroleptic, and then I have to reflect on some of the patients that I've followed for 12 or 15 years, and some of them are doing very well and some of them aren't.
Yeah.
And
it isn't with a blanket. Just like you can't use a blanket on the brain to get rid of tics, you can't use a parenting blanket to kind of take care of kids with severe symptoms. It has to be a skillful intervention that both protects and supports but also challenges, so that kids, when their symptoms are better or when they need to kind of move into independence, they really have the skill set ready to go so that they can do that.
And I think that's really the goal, is to foster resilience as much as possible, because those are the kids that I see that are doing the best.
The resilience is good any way you look at it.
Well, you know, and I think 5 years ago we probably weren't very good at training parents how to create resilience, and I think we're just beginning to learn how to do that. So if families have been in treatment a long time ago and they didn't kind of get there, they should go back, because I think we're getting better at doing the kind of behavioral stuff now to kind of train parents to raise kids that are stronger, more resilient, can bounce back from some of these difficulties.
well, one thing is the attitude toward the management of symptoms. If the attitude is that symptoms are only to be managed and managed by external devices like medications, that's not exactly fostering resilience.
Right.
And the
Right.
families that are more tolerant, say, of the tic symptoms, in a way might be fostering more resilience. But you were going to say something else.
Just a couple of things. Yeah, the resilience issue, I think, is extremely important, although I do wonder how much of this is learned versus how much of this is temperamental variation. Some people are more inclined to be resilient by nature, and others not so well.
I guess when I think about it, it's you know, we've all talked about minimizing the focus on tics because it's kind of hard to treat tics, but maximizing the focus on peer relationships, academic achievement, leisure activities, you know, positive functioning family and family roles. Those are the kinds of things that over time lead people to feel stronger about themselves, feel confident, be able to leave home in a positive way. Even if they're disabled, they have a better shot at kind of managing their disability if they've got that kind of experience. And I think we are moving into an era where we're talking about that with families a lot more. 10 years ago at Tourette Syndrome Association, we spent a lot of time talking about medicine, and I think we're talking much more now about the lives of people with Tourette and kind of what we can do to improve the qualities of their lives, that kind of stuff.
So do you think it's ever too late to build resilience?
No, but the longer you wait, the more difficult it gets.
Is
I
there,
like to
is
think
there
that
a critical period, in other words?
probably before they leave home, and it should be in place. After that, they don't have the resources that you have in a family to be able to tackle these things, and life priorities change, and you know, mom and dad are not there, or if they're there, they may be participating in the problem right along with you. So it's critical that these things be tackled around the age group that you treat, so that as adults we're not sort of stymied with trying to put into play things that should have been implemented 20 years ago.
Yeah, you know, one of the real research needs is rehabilitation strategies for impaired adults with Tourette syndrome.
Definitely.
And really thinking about the kinds of things that we could do to kind of improve the quality of their life behaviorally, because they've oftentimes had every medication known to mankind, and but they haven't really had the opportunity for kind of this business around building a life or learning how to live a life with a pretty severe disability.
And they're wearing their scars,
Yeah,
so that
they
by
are.
then you're seeing not only the biology, the layer cake, but a bunch of scars that may or may not heal.
Yeah. Well, you know what, guys? This was a great afternoon for me. I hope you enjoyed participating in this. When I think about all the educational materials that are available to people with Tourette syndrome and to the clinicians who take care of them, I'm not aware of one that's got in it what these videos have today. So I appreciate your candor, your sense of humor, your frankness in talking about the real complexities and issues in treatment of kids and adults with Tourette syndrome. Thank you all very much.
Thank you.